Prevention and the preparedness of countries are key to contain the epidemic. And Senegal and Nigeria have shown that this is possible. And this is the reason why the European Union is supporting and funding the West African government to develop and test national preparedness plans. Just to give an example, how we are doing this. Firstly, under the instrument contributing to stability and peace, the European Union has provided 13 million to support regional coordination on preparedness. We're using this money to provide experts, public health specialists, program management experts to the different countries. We are providing training and capacity building to support regional and national preparedness structures. And these actions are being channeled through the World Health Organization. Secondly, I just mentioned that we have prepared preparedness plans with each national authorities. We are trying to redirect ongoing programs, or we are just using unspent funding to identify gaps and needs in this preparedness plan. And we are doing this with more or less 11 million to help this Ivory Coast, Guinea-Bissau, Mali, Burkina Faso, Togo in their implementation of this preparedness plan. And just to give it you an example, I will say that in Ivory Coast we are helping to refurbish and equip an Ebola treatment unit at the Central Hospital in Ivory Coast. In Guinea-Bissau, we are helping to supplement our water and the sanitation program with just hygiene messages that are crucial for the preparedness. We are in Burkina Faso setting up a national preparedness plan support facility. These are just some examples of clear, concrete actions that we are putting in place in neighborhood countries. Our focus must continue to be to help countries to emerge from the crisis and, of course, build long-term recovery, as we were trying to do before the crisis and as we are trying to do in parallel. Last week I visited Guinea and I saw the terrible effect of this outbreak on the ground. I was really struck by the devastating impact of Ebola on many sectors in the countries. This crisis not just challenged the health sector, it has to be clear. It has also a real impact on the economy and on the governance. So many areas of society are affected by the epidemic. Health services are stretched. This means that it's critical for our future that we ensure that these countries have, of course, a well-functioning health systems, but I will say also that it's critical that we address quickly also the key social and economic development sector that are affected by this crisis. So I am talking about the macroeconomic stability, education, agriculture, and the governance. And of course, we must not forget the wider preparedness of the region to respond to such outbreaks when this will appear in the next future. And of course, I hope not. So, to tackle all these challenges now, we need a robust, effective, and coordinated international responses. In our high-level seminar, in our senior high-level discussion last Friday, this was absolutely clear. We must now, from today, start planning and starting preparing the period after Ebola. And to do so, we need to carry out a detailed need assessment to ensure a better and more efficient coordination. We have to do this among the European Union institutions, with our member states, but of course with our international partners. And coordination will continue to be the key factors. So we are sitting around the table with the World Bank, with all the UN agencies, with our member states, in order to be able to identify what will be the needs to face and to tackle the after Ebola crisis. I am confident that the European Union will show its ability to steer this process and to assist the affected countries in the best possible and sustainable way. And when I am saying about sustainable way, I would like to underline that the identification of the needs assessment, our future answer to the crisis, has to be something that needs to be prepared with the concerned government, with the governments of the affected countries. We want ownership, and I am very happy to say that we are saw a progress during this last month. We are now working with national government, with national and local authorities that are ready to tackle completely and globally the effect of Ebola crisis. So I would like just to conclude that, of course, the European Union stands firmly side by side with the people of Guinea, Liberia, and Sierra Leone, with their authorities in overcoming the Ebola crisis. And of course, I think we want all to make sure that these countries can recover quickly and get back on a sustainable path of development. And achieving this will require, of course, medium and long-term support.